Good afternoon, and I also like to thank the center and Dr. Karinger for having me today. I'm with Black Women for Wellness. I'm a community liaison for them, and I am a covered California certified educator.
All right.
So that I can go into the churches, into community places and spaces and talk one-on-one about the Affordable Care Act. I'm with Dr. Hickey. I'm so glad that we do have the Affordable Care Act. It gives us a chance to have preventative treatments, mammograms, pap smears, colonoscopies, things that we couldn't get before. And once we find out about it, it's too late for us in our communities. And I also thought about, it is a moral to have it, but it's also a social justice issue for me.
All right.
Because if we are healthy, like Dr. Hickey said, we can have good educations, we can further our educations, we can get good jobs, and that'll put us on a level playing field, and I think that's why the Republicans wanted to get rid of it so bad. How many times you take something to 37 times and to the Supreme Court and then shut the United States of America down because you don't want to see poor people have an opportunity for health care, for education, to stop being underemployed and unemployed. That's going to put us on a playing level field. So that's how I see it. Another thing that I think is with the Affordable Care Act, I'd like to say this. Now, we can go out and educate, and there are other people that are called certified assisters that can actually enroll you in the Affordable Care Act. No money is to change hands. They can give you how much it's going to cost, and whatever, you call the 1-800 number, or they sign you up and the insurance company calls you back. But if anybody asks you for money to sign up for medical care, then that is not a covered California person, and no money is to change hands.
All right.
I noticed that we had I was at the City of Refuge this morning, and they didn't want people to be there to sign people up because they have already had some scams run. People have already written $200 to $300 checks in order to get insurance. That's not the way that covered California operates. It goes on your income, how many people are in your family. They send the information, and whichever insurance company you've chosen through SHOP, then they send you a bill back, and if you qualify for assistance, the government pays the assistance for you, but no money changes hands. I just want to make that sure. Don't write anybody a check. Anyway, I'm with Black Women for Wellness. That's right over here in Leimert Park. And we go out to the beauty shops and the barber shops because they're the people in our communities that do not have insurance. Most people that are independent contractors don't have insurance. So we're reaching out to the beauty shops, barber shops, and most of the non-profit organizations with 50 members and under. And we're right over here in Leimert. So that is what we're doing, just trying to reach as many people as we can, teach as many people as we can, and guide them in the right way and let them know who is taking advantage of them. Now, I've always gone to Cedars, and about the electronic things, I can tell them, so-and-so is going on, oh, we know Miss Kissy, blah, 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 blah. I said, well, how do you know? Well, it's right here. They transferred it from one doctor to the next doctor, so it's no use in lying. They know what medications you're on, they know what your blood pressure is, and we really don't have that in our communities, and we do need that, so I'm so glad that is happening. And my brother-in-law is a geneticist.
All right.
And he told us that they're trying to make individual medications for individuals, through your blood type, the genetics. And each person will have their own medication, but African American people do not want to participate in clinical trials. We claim we're guinea pigs, but if you don't participate in clinical trials, the new medications that they're coming up with won't be any good for us. Only the Anglo-Saxons and whoever is participating in the clinical trials will have these new medications. So we have to step up and start participating in clinical trials. And all clinical trials are not medication clinical trials. Some of them, they ask you questions, they ask you how you sleep overnight, and they watch you, but everything is not a medication clinical trial. So I would advise, for us to start thinking about clinical trials.
Okay.
And all I wanna say is I think it's a social justice issue. It's gonna put us as African Americans on another field, another plane, and we have to use the Affordable Care Act to get where we need to be. Thank you very much.